Hey everyone, it's Dr. Hodges. Oh my goodness, Happy New Year, and it's been forever since I've made a video. Even Vanessa in my office said, Dr. Hodges, I haven't seen any recent videos come from your feed. I have been so bad, so I'm going to do better. I kind of have a day off today. Day off. I'm just not in clinic today, so I'm literally going to spend the whole day making some videos. And so just for you guys. All right, so I cannot find my selfie stick, so I'm literally using my knee to help stabilize my arm. What I'd like to do is I have my laptop open because I want to be able to give y'all some accurate information about the different injectables and how they work, so that you just have the best information. There's a lot of misinformation on the market. There's a lot of noise surrounding these injectables, and so I really just kind of want to set the record straight. But I think it would be helpful for me to give you a little bit of the history about them so that you know why your doctor may be prescribing one medication over another, because they may be doing it to help you if either insurance doesn't cover it or if there's specific coupons or whatever. So basically in 2010, Novo Nordisk created a medication called Victoza. The generic name is liraglutide, and that was used as an adjunct to diabetes therapy. It is not a primary therapy for diabetes. And this is why patients that do not have diabetes can take these medications and you don't have like a huge plunge in your blood glucose. So it's not like you're taking insulin whenever you take one of these injectables. So they made Victoza, and it was a once-a-day injectable. And what they found is that not only did it help patients lower their hemoglobin A1C, but it also helped to decrease patients' appetite. So they then just went back to the FDA and said, hey, guess what? We have this great new drug. We're going to rebrand it. And they rebranded that medication as Saxenda. And so Saxenda and Victoza are the exact same drug. They have the same basic dosing. You're actually able to get a higher dosing on Saxenda. It's been FDA approved for higher dosages whenever you're using it, whenever the indication is for weight loss. So liraglutide, Saxenda, and Victoza are all the exact same drug, okay? It's just rebranded as a different name. Then they went back to the drawing board and they thought, hey, we need to see if we can make a longer acting drug. And so they came out with, the same company came out with a medication that is called Ozempic. And Ozempic has the same indication for diabetes. It's not a primary therapy, it's an adjunct therapy. And so once a week dosing. And again, just like whenever they found with Victoza, they found that patients would lose weight. They had really good appetite suppression. I'll go into a little bit of the mechanism of action here in just a moment. And they had that approved, and that was approved in 2015. And so Ozempic has been on the market since then. It's now, 2023? So it's been on the market for 7 years now. Did I do my math right? 2023, yes. And so with that medication, they went back to the FDA and they rebranded Ozempic as Wegovy. Now, the generic name for Ozempic is called semaglutide. So if you go online and you see semaglutide, that is the exact same drug as Ozempic, and it's the exact same drug as Wegovy. The two name brand names are Ozempic and Wegovy. The generic name is semaglutide. Just like the name brand of Victoza and Saxenda are the same, but the generic name is liraglutide. Okay, now these medications are what we call GLP-1 agonists. So what is that? And so just so that we can all make sure that we get the point on whenever we play Trivial Pursuit, a GLP-1 agonist is a hormone, and what it does is it is activated whenever you eat. So when you eat, you swallow the food, it goes into your stomach, and then that food enters into your small bowel, and it's like a negative feedback mechanism. And so that will stimulate the pancreas to make insulin, And it also does a variety of other actions. So it sends a signal to the brain that says, hey, there's food you've been eating. We now need to slow down the gut. So you're already eating. You don't need to eat anymore. So it tells your brain, number one, you're full. And number two, it slows gastric emptying, and it allows your stomach to begin the digestion process of the food that's already in it. And so that is essentially why whenever you take this medication, it bypasses the stomach, so you don't have to have already eaten. And that's why it kind of tells your brain, number one, I'm full. And that's why, number two, when you take the medication, you kind of eat less because you already feel like you're full because your gut has already kind of slowed. Does that make sense? So what are some of the possible side effects from taking this medication? Well, whenever you take the medication, you can have constipation. Why? Because it slows the gut. Number two, sometimes patients might have feelings of bloating, or they might even have feelings of nausea. Why? Because you have slow gastric emptying. And when I say gastric, I mean stomach. Sorry about that. And so who is not a candidate for taking these medications? So they always say if you have a history of pancreatitis or a history of pancreatic disease, if you have a family history for medullary thyroid cancer or MEN type 2, these are just different cancers that you can have. One is a cancer of the thyroid, and one is it's like a trifecta of cancers that you can get, but it does include medullary thyroid cancer. There is some indication that patients, if you have type 1 diabetes, you should not use some of the GLP-1 agonists. I will say, in my experience, some endocrinologists don't have a problem, but if you do have type 1 diabetes, you definitely need to consult your primary care doctor or your endocrinologist to see if you can take this medication, because they like to do it on a case-by-case basis. And so that is the science behind it. What are the names? Semaglutide, liraglutide, Ozempic, and Victoza. What about this new medication that's on the market that's called Mounjaro? So Mounjaro is a combo medication. And with Mounjaro, it is both a GLP-1 agonist and a GIP agonist. GIP is just one more gut hormone that works in a very similar fashion to GLP-1. Now, Mounjaro has a generic name, and it is called tirzepatide. Okay? I probably said that wrong. So sorry. I usually just say Mounjaro. Where are in all the indications are going to be the exact same. Right now, Mounjaro has not officially been FDA approved for weight loss. I don't believe. Let me Google that just super quick while we're watching. Although I know, like, black box, like off-label use has been used for weight loss, and I've certainly used it in my practice for weight loss. So is Mounjaro indicated for weight loss? Let's see. Yeah, so it was just approved in 2022 for type 2 diabetes, but it is right now being fast-tracked by the FDA for weight loss approval. So I think there's probably like a black box warning. So I think one of the things that I've seen on the market right now and online is this safe for long-term use, and is it bad if people use it, and XYZ. The reality is that these medications, especially the once-a-day dosing medications, they've been used since 2010 because that's Victoza. They are safe medications. I think the downside with these medications is that they're so expensive. Um, I know that there are some compounding pharmacies that may compound the medication, but it's very important that if your doctor is using a compounding pharmacy, that they're using a good, reputable um, pharmacy. They Not all of them are good. Some of them are a little fly by night. So it's just really important that you know the medication that you're using. It is not uncommon for patients to ask me for a paper script and then they try to use a medication, a Canadian pharmacy or a pharmacy in Mexico. I never recommend that patients do that just because we don't have any control over those pharmacies. There's no regulation. And so I can't guarantee what medication that those patients are actually getting. So I'm not a really big advocate for patients using pharmacies outside of the United States just for patient safety. Although I will say, half of my family live in Canada. They're Canadian. I was actually born in Halifax. So I always just like to say buyer beware. But do I think these medications are safe? Yes, I do. Do I think that they work? Absolutely. And what I've actually found is that if patients don't have diabetes, in my clinical experience, my non-diabetes patients seem to have better appetite suppression compared to my diabetic patients or people that have had a history of diabetes. Furthermore, patients that have had previous weight loss surgery, they also seem to respond much, much better to these injectables than my patients that are just pure medical weight loss that haven't had any weight loss medicine. So, I hope that this has helped. Really inquire with your doctors about these medications. They're good, safe medications. I will say Ozempic and Victoza, they are not primary therapies for diabetes. I believe if patients were going out and trying to take somebody else's insulin, then I might have an issue with patients using it for weight loss. But the reality is that obesity is a chronic disease and we need to treat it as such. And I believe that we need to be aggressive with the treatment of obesity. So talk to your doctors about these medications.